I know we wanted to talk a little bit about surgery, so I'm going to open it up with my personal story. And Dr. Tindall, on the 19th of this month, it will have been 3 months since I had my ACL replaced. I had it reconstructed from my hamstring, and my rehab is going well. My doctor was very happy at my 2 month checkup. My 2 month checkup at how much I had progressed. But when I wake up in the morning, or if I haven't been using my knee, it's stiff. And for people who have had any type of surgeries, I don't know if you would consider that an elective surgery, because I guess I didn't have to have it replaced, but I wanted to continue to play soccer, so I did. But anyone who's had either necessary surgery or elective surgery, is it typical for me to still have stiffness almost 3 months after this type of surgery? And what about other types of surgeries?
And you'll probably end up having it forever. Because scar tissue, it doesn't matter if it's reconstructive surgery, reparative surgery, or just daily wear scar tissue. Scar tissue has 1,000 times more nerve endings than regular tissue. You can close your eyes, run your hand over your skin, and you don't have to see where the scar is. You know, because it's highly sensitive. There's more afferent fibers there. What the Vitalzym does is get the inflammation out of the tissue and starts eating the lumpy scar tissue. You've got two types of fibrin. You've got the fibrin that glues the two sides together again. And that's like real big balls. And then the lumpy, because the body feeling that sensation, the sensitivity, throws more fibrin to the area because it wants to protect it, because it feels it's not as good as regular tissue. And that's where you get the lumpy scar tissue. And that lumpy scar tissue is like little balls. And I was talking about the Pac-Man going through your body, eating up. They can eat up the little balls that make up the scar tissue, the lumpy part, and not hurt the good fibrin, which is the big balls that holds everything together. So you've got to keep eating it off, because the body keeps wanting to put more fibrin into that area that's been damaged.
And when does it stop sending new fibrin there?
It never will.
It never will. So you got to continue.
Because of the sensitivity. You'll never lose the sensitivity because scar tissue just fires more to the brain. But if you're eating off the scar tissue, the brain doesn't get that signal as much. But it's using up enzymes all the time to do that, to eat off that lumpy. So you've got to keep putting enzymes back into the system to make sure your bucket stays full so it can stay ahead of it.
So what about women who have had breast implants?
Same thing. You're dealing with the sensitivity of that scar tissue and the lumpy part of the scar tissue.
Have you ever watched that television show Nip Tuck?
I don't, but I've seen the program.
I just recently started watching it. My sister Julie kind of turned me on to it. So we have Netflix, so I've been ordering the past DVDs and watching it. And it just amazes me that so many people would just go and have a facelift or breast augmentation. And here I am stressing about having knee surgery, which is, kind of important to take care of that, right? I was really considering not doing it, but my doctor said, well, if you don't do it, it's a matter of whether you get an ACL replacement in your 40s or a total knee replacement in your 60s. So I was kind of scared into doing it. Plus, I want to play soccer again, so I called Dr. Martin. I called Dr. Wong, and they said, you really should have it done. And, as much as possible, I don't want to do any surgery. And I think if people saw how, I don't know if Nip Tuck is a true representation of how they do facelifts, but people saw what they did to
their tissue,
to to do it. You know how they separate your scalp sort of from bone, and then they pull it up and skim some off and sew it back together. I don't think they would do it. I just can't imagine. And I'm worried about the scar tissue. I'm worried about the blockage of chi flow once you have a surgery, because that all comes into play once the skin has been damaged like that. Of course, I'm on systemic enzymes. Been doing it since I got injured, because I want to address that area very much so. But I mean, how do these elective surgeries? I mean, not that we're here to convince people not to do elective surgeries, but how important is it for people who do these type of elective surgeries or any type of surgeries to take Vitalzym? Because if they don't, what will happen?
Well, you'll see a lot of people that have had, plastic surgery, and years later, if you look at their scars, they're lumpy. And they have to go back in there and remove that scar tissue again.
You're talking about the area where they were cut.
Right.
Okay. So you're talking about the keloid.
Any place where that scar tissue has developed, the body's going to keep throwing fiber in there. So it's like a back surgery. When somebody has back surgery, even though most of them are not successful, the ones that are say, oh, gosh, great. But the problem is they're going to go back in there again because scar tissue is going to get developing, and that's going to be sensitive, and they're going to start having pain again. And usually after about the third surgery, the people say, fine, just give me painkillers. I can't go through the surgery again.
So you're talking about, Dr. Tindall, not the scar tissue that I'm referring to, which is what we can see on the top of the skin, right? Because, of course, veins. So that's the scar tissue I'm concerned about. But you're talking about the underlying scar tissue where the brain sends signals to send fibrin or scar tissue to that area to sort of heal that area, but it doesn't stop sending the scar tissue. So the scar tissue starts growing and growing, and then it starts infiltrating neighboring organs. Luckily, I don't have any organs in my knee, but it starts infiltrating neighboring organs, causing these organs. For instance, if you've had a C-section, even if it was 20 years ago, all this scar tissue, the buildup might be going into your colon or into your what else is down there? Your stomach. Is that what you're saying?
It will just. The brain does not, all it does is receive information. When the brain gets the information of aberrant fibers, that their sensitivity, its protection mechanism kicks in. And it's going to send more fibrin to make that. It's like when you break a leg, where you broke it, it's much stronger. And it will probably never break at that location again because the body is reinforcing. Well, that's what fibrin is doing, is reinforcing to make sure that area doesn't tear again. Unfortunately, it just keeps building and building, and the cycle of signals just keeps increasing and increasing. And you were talking about a C-section and adhesions. That's why women that are in their 50s, they say, well, I got adhesions. Well, it's already healed. It healed 30 years ago. But the body is constantly throwing more fibrin on it. And your body has only got so much enzymes available for that. And once you use them up, you use them up. It's like cirrhosis of the liver. You start getting scar tissue there, and the scar tissue keeps growing. And eventually, that is the one thing that I think most medical doctors agree with is we get a strangulation of fibrin around our organs as we age, and that's what kills most of us, is that it strangles the organs. So you just got to replace it.
Just have to replace those systemic enzymes, again, not to be confused with digestive enzymes, which help to break down the food that you eat. Systemic enzymes help to break down the fibrin or the scar tissue within your body.